Welcome to your Dogcast, where we feature news just for dog lovers. Here's your Rover Reporter, Mary Lou Davidson.
Hello, I'm Mary Lou Davidson, and this is the Rover Reporter. Today we're talking with Dr. Jim Dobies, and we're going to cover some of the basics of pet first aid, things you should have, things you should think about, and things you absolutely need to leave to a professional. Welcome, Jim. Thank you for coming back on the show.
Thanks for having me, Mary Lou.
Yeah. So one of the things at this time of year that we all think about with our dogs is keeping their temperature regulated and watching out for heat stroke. And I think that, when you start feeling like you're too hot, your dog's probably too hot as well. But what are some of the signs that you can note that that's coming on?
Yeah, that's a great question. And, in particular in Florida and throughout the Southeast, the humidity and the air quality can really start to factor into this. And that's where you really have to kind of pay attention to those heat index numbers. I recommend that if you're going to do any sort of an outdoor activity with your dog, you do it early in the morning or in the evening after the sun's gone down. Because generally speaking, if you place the palm of your hand on a surface and it's hot for the palm, it's going to be hot for their feet. And you have to bear that in mind as you're walking, especially in the sun, that those surfaces can be well over 100 degrees and it can cause burns very quickly. As far as heat stroke is concerned, what that really is a physiological phenomenon where the dog is just unable to cool itself any further with using its natural mechanisms. Dogs don't sweat the way people do, so we don't get evaporative cooling. They have to blow off the heat through their mucous membranes, and so when they get hot, they start to pant. And as they pant, the moisture in their mouth helps to evaporate and helps to radiate some of that heat off. But if they're outside for more than 5 minutes in a very hot setting, or as we know, in a vehicle where it can get extremely hot, their ability to regulate that temperature is really non-existent. And so they'll develop basically what's called hyperthermia, where their temperature starts to rise. And if they're above 105 degrees for any more than about 5 or 10 minutes, it can really start to go badly very quickly. So if you start noticing panting, a lot of swelling around the throat and the tongue, you want to get back indoors immediately. You want to make sure the air conditioning's on. It's usually best to wet their paws with just normal tap water. And you can also wet their ears with tap water, not ice water, just normal water. And that helps start the process of cooling them down. In cases where that doesn't work in the first 10 or 15 minutes, that's when I usually say, hey, call your veterinarian or head in to have them checked out quickly.
Mm-hmm. So wetting the paws is the thing rather than submerging them in a tub.
Correct. Yeah, because you don't want to overshoot it. Their ability to self-regulate is already starting to break down at that point. So you can, if you submerge them, you can take them from being overheated to hypothermic very quickly, and that can lead to shock. So it's usually best to just wet the paws, wet the ears, give them access to fresh drinking water and a nice, cool, air-conditioned environment.
Okay. A lot of people think that they should give their dogs a summer cut so they'll stay cooler. And that's the antithesis of what they should be doing. Am I right?
Yeah, I grooming is a very personal type of decision to make. And if you're doing it for cosmetic reasons or because of shedding and that kind of thing, completely understand it. But that really, unless it's something like a husky, right, that has just this unbelievably thick Arctic type coat, it's not really going to mean the difference between a regular coated dog staying cool and just having their normal fur. That fur is there for a reason. It's designed to help them acclimate. And it kind of, I think, lends itself to giving people maybe a false sense of security, when in actuality it probably doesn't matter a whole heck of a lot because of just how hot it can get in Florida and the Southeast.
Mm-hmm. Okay, so in terms of prep for heat stroke, there's really nothing that we have to have or buy. We've got AC in the house, got water. What about like simple accidents, like, grabbing a thorn in a pad? I mean, is that something we need to rush to the ER? If we can get it out, can we ice it and bandage it?
Yeah, I think that a some form of having a first aid kit is helpful, right? Want to have some gauze, you want to have some bandages, you want to have some medical tape. A really, really good cleanser is just pure saline. Just get a bottle of squeezed saline to have on hand to be able to flush out eyes or flush out wounds. I don't usually recommend hydrogen peroxide because I find that folks tend to overuse that. Hydrogen peroxide is great on a wound the first time it happens. It kills bacteria. But if you continue to use it on a wound, it will actually slow down the healing process because it's cytotoxic. So I like just plain old soap and water or saline. And then, you can get, some Neosporin or some other type of antibiotic spray that's topical. The real difficulty in pets, of course, is that they'll lick it. And it won't hurt them to lick it, but it doesn't really help the wound if they're licking it off. But then you can also have, scissors and tweezers that you can use. Word of caution with scissors. I've seen so many folks trying to cut a burr or some other type of thing out of a pet's coat, and they end up clipping the skin. So it's usually best to get, a pair of bandage scissors or another type of blunt scissor, so that if you do nip them a little bit, it'll pinch them and they'll pull back before you actually end up cutting the skin.
Those are the snub nose scissors. Yeah.
And the wireless trimmers are actually probably safer if they're hold still for them. But of course, the buzzing, especially around their face, they don't always appreciate that sort of a thing. But just getting back real quick to the temperature thing, there are a number of different ways that you can purchase thermometers these days. Unfortunately, still the most reliable thermometer in dogs and cats, especially for people at home, is the rectal thermometer. It's not the most pleasant in the world, but if you really want to know what their temperature is and be confident, then the rectal thermometer, and you can get the pediatric ones that beep when they're done. And that way, okay, well, the temperature is normal. And for most dogs and cats, up to 102.5 is normal. Anywhere between 100, 102.5 is fine. If it's above 103, that's a fever. If it's below 99, then that's hypothermia.
Okay. And on the saline solution, that's just like what you use for contact lenses, yes?
Yeah, you can get the generic bottle of sterile saline and just keep it in the pack along with the other stuff. And then the nice thing about it is you can get some pressure on it when you squeeze it. So if you have a wound that has some dirt or some gravel or that kind of thing in it, it really helps to be able to just use that to kind of direct the debris out of the wound.
Flush it out. Yeah.
Yeah.
And what about, I hear about snake bites, and I know that there are some that can be deadly. How do you detect that that's gone down, that it's happened with your dog?
It can be really challenging. We see this a lot in after hours medicine where it's, twilight or dark and the dog goes sniffing around in a bush and yelps and jumps back and comes back to the owner with a wound, and you're not exactly sure. The most important thing to remember is snake bites, if they're venomous, are pretty painful. And so a dog that gets bitten by a snake is probably not going to want you to touch the affected area, and it's probably going to swell pretty quickly. And if that happens, the pain and the swelling, that's get to an after hours ER as quickly as possible. In Florida, we have venomous snakes that are life threatening, but then we also have venomous snakes that just cause local irritation and necrosis in the tissue. And so that's where speed is your friend. The faster you can get to care, so that if it is something like a pygmy rattlesnake, they can administer antivenom as quickly as possible. If it's, a non-venomous snake or one of the snakes that isn't going to be life-threatening, then supportive care is sufficient. It's those rattlesnakes that can be a real problem.
And probably not a bad idea to have a muzzle on hand.
Yes, definitely. Any pet that is in pain will have a tendency to bite. It's not because they're trying to hurt you; it's because they're uncomfortable themselves. So if you have a muzzle that fits appropriately, that's great. In a pinch, you can also use gauze, and you can just tie a gauze string around the dog's muzzle. For cats, absolutely must have a kennel or a carrier. You never want to bring a cat, especially an injured cat, to the veterinarian or even in the car without a means of safely restraining it. If you're really pinched and you don't have a carrier, a pillowcase works wonders.
Okay. I had a scenario once with a dog that we were at a dog park and I thought he was choking, and he was actually having his first epileptic seizure.
Oh my, okay.
Which I was unaware that was an issue. So thinking he's choking, I stuck my hand in his mouth to clear his airway. Is there any way to tell the difference between, how do you know, the behavior was so erratic and it was a panic. So I did the only thing I could have done, but would I have had any sign to look for that it was a seizure?
The first time, because the behaviors can be so variable, it can be difficult. Obviously, with your standard grand mal seizure where they go into convulsions, that's pretty recognizable. They're usually on their side. They're usually frothing at the mouth. They're usually trembling or convulsing. But partial seizures and other types of neurologic behaviors can be really challenging to evaluate, especially if you don't have medical training. So when in doubt, I think taking them in and getting them checked out, making sure that there's nothing metabolically wrong or that there's not any kind of toxicity going on is always the best way to go. But the good news is, for true seizure type behavior, we know that the patients lose consciousness. So it's much worse to look upon as a pet parent than it is for the animal experiencing the seizure. They don't know what's going on, even though they don't look comfortable. Everything's disconnected up there. So the good news is if it runs its course and they come out of the seizure afterwards, they're usually maybe a little lethargic, but they're back to normal. And then, you have to take them in to make sure that they don't need additional medication to manage those seizures. But they usually recover from it just fine. And unlike people where there's a risk of vomiting and aspirating, that doesn't usually happen in dogs. So usually they're pretty resilient when they come out of that type of behavior.
Gotcha. Are there any sort of over-the-counter medicines that we should have in our toolkit, like Benadryl or?
Yeah, Benadryl for me is the most innocuous. It would be very difficult unless you're giving a bottle of Benadryl to overdose a dog on it. You would want to check with your veterinarian beforehand for what an appropriate dose would be for the size and the breed and, any pre-existing conditions that might be going on. But, there really isn't much downside to having Benadryl handy. And, the liquids or the tablets or the capsules, depending on the size of the dog, are all appropriate. And it's not going to cause any harm. I think where we sometimes get into trouble are with anti-inflammatories. And there are some that are okay for use in pets. There are others that are a big no-no in pets. So I prefer for you to have, an anti-inflammatory that's labeled for use in dogs or cats rather than to try to give something at home for that sort of thing.
Gotcha. So we've been talking about what happens when it's your pet that has a traumatic experience or needs some immediate help. What about if you're driving down the road and you see a stray dog, a dog that's obviously away from home, looks injured, maybe, don't know. What do you recommend that folks do if the dog appears friendly and looks like it needs help? I mean, given that we can't assess every single situation out there, everything's unique. But maybe it's a neighbor's dog that you happen to know that's loose.
Yeah, I think the big thing is to just evaluate the situation before you take action. If you, for example, are driving down the street and you see an injured dog, stopping. As soon as you stop, there's probably going to be other Good Samaritans that stop along with you. And there's definitely going to be more safety in corralling an injured animal when you have more hands, right? You also have to think ahead. Do I have the means to safely restrain and safely transport this animal? If you don't, for example, if it's seriously injured, pull over and call 911. The police department will come out and assist you at that point. But let's just say it's a small to medium-sized dog and it's not terribly injured and it's friendly. You can safely get it into your car. Hopefully you have a leash or some other type of device that you can use to get them safely into the vehicle, and then go straight to any veterinarian that's open. Most veterinary hospitals now have the universal microchip reader. So they'll be able to scan to see if the pet has a chip. Hopefully they do. If there's no chip, then looking at social media and checking with the Humane Society or the dog shelter in your area and checking those neighborhood apps. There are a number of neighborhood apps now, including our Ring cameras, where people will report either animals that are missing or animals that have been found. And you can usually track down the owner fairly quickly. If there is no owner, then the veterinarian who evaluates the dog should be able to tell you, whether the injury is serious or not, and, what it would be, approximately from a cost perspective to get them patched up and that sort of a thing.
Right. And many rescue organizations will occasionally step in to assist with funding, or even the local county shelter is possible. So
absolutely. Yeah. And it's not, obviously you probably want to keep an eye on whether the dog is adopted from the shelter, but typically when they go to the shelter, if I'm, talking to a pet parent or a client who has lost a dog, that's the first thing I'm going to say is, hey, call the shelter every day for the next few days, because if your dog is missing and stray, there's a very good chance that they'll turn up there. And that way you can get reunited with your pet.
What do you think about the air tags for dogs and cats?
It's interesting. The tech has gotten better and better, and I think that there's a real utility in that. I keep waiting for somebody to develop the microchip that would be able to serve that purpose. But unfortunately, no one's been able to get that tech done yet at this point. But yeah, I think especially if your dog has a tendency to break containment on the electric fence, or, beagles and basset hounds are notorious for following their nose across the countryside. Any of the wearable tech is really, really cool for being able to track the dogs down that way.
Yeah. If you've nicknamed your pet Houdini, then you need to put in the AirTag. So, Jim, Thank you so much for this time and information and insight to help people be prepared in case of an accident or some mishap with their dog. We really appreciate it.
It's always a pleasure to be here. Thanks again for having me.
Thank you.